You're tuned in to the Andrew Lawton Show.
We have been talking for the last, 15 months now about the havoc that COVID has unleashed on societies around the world, on communities across Canada, certainly included in that. But missing from the discussion in a lot of cases has been the impact that the response to COVID has had on communities. We've talked about this on this show, but I think certainly in a lot of the public health dialogue, the effect on the economy, the effect on just individual livelihoods has not really been told. But there's been a fantastic project by the Macdonald-Laurier Institute called the COVID Misery Index, which doesn't mince words. It is misery. Let's not deceive ourselves here. But they look at not just what COVID has done, but also what a lot of the government's responses to COVID have done around the world, including in Canada. One of the contributors to this is a Memorial University of Newfoundland professor of health statistics and economics, Professor Richard Audas. Professor, good to talk to you. Thanks for coming on today.
Yeah, thanks, Andrew. Thanks for having me.
Now, even, by the way, I must say your title I really like in this, because a lot of the times we get people that are just focusing on the health and not the economics, whereas you've actually, through this, looked at both of these.
Obviously, the disease has had an impact, but how governments have responded to the disease has kind of, brought differing levels of misery across different provinces and different countries, and of course the economic fallout. And one thing that's been pretty remarkable about COVID-19 has been obviously the huge effect it's had on the economy. Now we sort of seem to be moving towards a recovery, although the recovery is not even. Some provinces bouncing back more quickly than others, and then finally, looking at the public health responses again, the level every time we go into lockdown, that makes us a little bit more miserable. The speed with which we can get out of this situation largely through vaccines or even aggressive testing patterns, again reduce the misery that's heaped upon us. So again, what we wanted to do was take a holistic look, or as holistic a look as we could do with the data that's available, and actually see where, of course in this case, looking across Canadian provinces and seeing which provinces have done reasonably well, and which provinces have been a bit more miserable, or quite a bit more miserable in some cases.
And I should say, this is not a truly global index. There are 15 countries, all developed nations, that are on this list, which I think emphasizes the point that Canada is not exactly in a position to be proud of here. We have the chart up on the screen there. Canada, 11 of 15 for total misery ranked, a few notches below where the global average is situated on this. Do you find that there are one or two provinces that are really dragging Canada down, or do you find even with the differentiation from one province to another, Canada is generally in that pretty consistently in that realm?
No, there's actually been pretty big differences across provinces, and I think the way you experienced COVID-19 is pretty different if you live in Alberta, Ontario, or Quebec, who are the three, we'll say, most miserable provinces, or experience the most misery, as compared to Atlantic Canada. So in Atlantic Canada, the situation has been quite different. Case counts have been relatively low. There's been, some returns to normalcy, again, with various incidents, that are causing, a return to lockdowns when necessary, or when deemed necessary. So, I do think that, the differences, what you experienced was very different in Alberta compared to what you would have experienced in Prince Edward Island or Nova Scotia. And again, I think that that you actually sort of look at the countries, provinces like Nova Scotia, Prince Edward Island, kind of look a lot more like Australia and New Zealand, who've done quite well during the pandemic, as compared to Ontario and Quebec, which kind of look more like the UK or some of the Western European countries that haven't done quite so well.
Is disease misery an apples-to-apples comparison to COVID response misery? Because looking at just Canada and the U.S., for example here, the U.S. has a disease misery on this index of more than double what Canada's is, but it has a COVID response misery level that's a little over half of what Canada's is. A lot of people, if they were just looking at death rates, for example, would say that those two aren't even in the ballpark, but the U.S. is actually scoring a bit better overall than Canada.
Yeah, and I think that, some of that narrative, I think, does come up from early in the pandemic, where clearly the U.S. got it wrong, and was very slow to respond. But certainly what the U.S. has done is at least since then, although I think the evidence is suggesting it might be slowing down a little bit, but absolutely knocked it out of the park when it comes to vaccines. I mean, they were one of the first countries to approve vaccines. They very aggressively rolled out vaccines, and of course, in the U.S. and following the U.S. media, that as I do, they're very much looking at a pretty normal summer. with restrictions being lifted, case counts dropping day over day, death rates declining. So again, I think that it's been a pretty miserable experience for the U.S. for sure. But in over the last 4 or 5 months, they've really have kind of gotten their act together. And I think when we look at the sort of the total of what's occurred, the COVID's going to have a longer tail in Canada because we're going to be longer getting people vaccinated and certainly getting things back to normal.
From the get-go, Sweden became somewhat of a political football in this fight. It was held up, I think, by both sides as the example, in one case of what we need to strive towards, and in the other case of what we need to ensure we never replicate. And it's interesting that now, looking at this more than a year later, Sweden actually ranks pretty highly on this, just one step below Australia. And I find that interesting because Australia was very well known for how severe a lot of its restrictions were as far as quarantine. People were stranded abroad, even if they were Australian citizens, whereas Sweden was kind of open season in a lot of ways, yet they both look very similar to each other. What accounts for that?
Yeah, I mean, I think, again, the disease sort of manifests itself slightly different in different climates in different parts of the world. I think, again, the Swedish situation, although I think their response did change over time. I think their initial response obviously was to a bit more of a sort of relaxed attitude, shall we say, towards, locking down and things like that. Over time, they have sort of changed their, their approach to it, and they have become a little bit more conventional in terms of what's gone on in other parts of the world. I do think that essentially, I think particularly with the Swedes, generally, I think, even though they haven't sort of locked them down, they've been able to do things like maintain social distancing, mask wearing, things like that, all of which, or most of which is voluntary. There, or a lot of which is voluntary there. Again, they just kind of got on with it and took the restrictions that were necessary. I think in other places, these things had to be mandated by law, and that created some different challenges. And of course, there's also, even though the legal lockdowns in some places have existed, there's been lots of instances of people sort of skirting the rules or not quite adhering to them. And of course, the disease doesn't really care whether you sort of observe the rules or not. It just, if it has an opportunity to transmit itself, it does. And again, so I think that if we could have counted on everybody to sort of, to do the right thing, I don't think we would have necessarily had to go into lockdowns the way that we did. But again, I think that wasn't, I think there's pretty big differences from country to country on those issues.
When we look at the data, do they tend to show that you either have a really strong disease misery level or a really strong economic and response misery level, or have there been some different balances we see there?
Yeah, I mean, there certainly have been some different balances. When we look across countries, the level of Norway, which comes out on top of our list, where admittedly the disease count was lower than a lot of other countries, but not radically dissimilar. But they had very little economic impact. They were able to use their tremendous sovereign wealth fund to kind of keep things going there. And in other cases, we saw countries where for instance, say here, I'm actually in New Zealand. We've had very few cases, but actually the economic fallout has still been pretty large. Again, the tourism industry largely shut down here. Pretty big, massive amounts of public borrowing to go in place largely to keep tourism operators in position, or the people who work in them in post for an eventual return to tourism. So I think in some cases, a country like say here, like in New Zealand, where we've had a pretty massive economic hit, but very little disease hit, suggests that there are some imbalances in those things.
Now, we've certainly seen a lot of discussion in Canada, rightfully so, about the very slow pace at which vaccines have been rolled out. And of course, the 4-month interval between the first dose and the second dose in Canada is going to be putting Canada at a tremendously lagging level when it comes to the rest of the world and getting their populations vaccinated. How much is a vaccine rollout affecting numbers? Because it does seem like in Canada, there's actually been, I don't know if I would say an uptick in deaths, but an uptick in a death metric that you use called excess deaths.
Yep. Well, a couple things about that. I mean, number one, I think the vaccines seem to work, and they seem to be very effective. And if you look at, I think the UK is the best example of that. I mean, that was a country that was a complete complete basket case. And now, things are very much getting back to normal. Fans are going back.
They've got
to
like 5,000 people in nightclubs now.
Well, exactly, and sending 10 and 15,000 people to football matches and things like that. So again, very much, so the vaccines there, and have very much been the path back to normalcy. And certainly that's what we're looking at in the U.S., where you look at the case counts, which day over day are a fraction of what they were a few months ago. So again, I think in that case, the evidence is that the countries that were able to get vaccines to people, have been pretty effective. Still, jury's still out on what's going to happen, whether the sort of the lengthier time delay between first and second shot is going to make a big difference or not. So that's what the UK did, and that's what a lot of Canadian provinces are doing as well. Whereas the US is opted to try to get second shots into people kind of more, a little bit more closely to the to the scientific guidelines, which suggest 3 to 4 weeks should be is the appropriate duration between shots. So I do think that this is something that is going to will have an effect over the longer term. And of course, until people get that second shot, they haven't got that full level of immunity. So again, they're still at an elevated level of risk. So certainly the evidence suggests the first shot is valuable and useful, but you get better benefit from that second shot. So I think as soon as people can get those, kind of the better we are, and the better off we are, and the sooner we'll get back to normal.
From a longitudinal perspective, I have to ask you, Professor, I mean, you're an economist. How long do you think a lot of this damage is going to last when we look specifically at the economic response and to some extent the COVID response misery level?
Yeah, I mean, I think that the economic impact is going to be felt for a very long time. I mean, you look at the amount of money that governments have borrowed to kind of get through this, and not suggesting it's necessarily the wrong thing to do. I often use the analogy that that if the roof blew off my house and I had to go get a payday loan to get it fixed, well, that would be the right thing to do, but it doesn't change the misery involved with it. I think governments were quite right to to go out and spend money to keep people from going back to work, and potentially to keep businesses that will be viable in the future still going. But the amount of money that's being spent here is almost at a World War II type level. I mean, it really is a massive amount of expenditure that in Canada we look at what the provincial governments, and also what the federal government has taken on for debt, and it's going to be it'll be decades paying that debt off, and unless there is a terrific amount of economic growth that is sustainable for the future, but I don't think that's terribly likely. So I think that this is something that we're going to be paying off, and it's likely our kids will be still paying off the interest on this one sometime in the future.
Yeah, and I'd be interested to see the effect on the tax base. I mean, we know certainly a lot of high-income earners who have the flexibility of being able to work from home weren't directly affected in the same way as others, but we know tons of businesses, tens of thousands of businesses in Canada have gone under. We've got some projections from organizations like the Canadian Chamber of Commerce that are suggesting tens of thousands of more of those. The effect that has on employment is pretty straightforward, but to really get a sense of how long we're going to be dealing with those repercussions is not really something we can answer yet, is it?
No, I mean, although it's something that we do see that the loss in economic activity and the amount of money borrowed. I mean, we're looking at federal government taking on levels of debt kind of tenfold larger than you hear of budget deficits of 30 billion or 25-30 billion as being pretty high, and of course this year they're looking at hundreds of 200 or 300 billion dollars. So again, taking on 10 years worth of debt in a single year, it's going to take a long time to pay that off, and and I think even the cleverest of economists can't really tell you what the economy is going to be doing 10 years from now. But certainly it's quite likely that there will be some hangover in terms of debt repayment, well beyond the next 10 years. So, it is something that's going to be that part of it is going to be with us for a long time. And again, not to say it wasn't necessarily the right thing to do, but when the next crisis comes, and the next crisis will come, it does limit our capacity to use fiscal tools to try to spend our way out of it. So whether it's a financial crisis or if it's a climate change induced crisis, there's going to be something that's going to come along where governments are going to need to spend money, and it's going to be very difficult to pay for that.
Well, we've all been living the misery, so quantifying the misery seems like the most productive thing we can do in the midst of all of this. You can check out the COVID Misery Index for yourselves over at Macdonald-Laurier.ca. Health statistician and economics professor Richard Audas from Memorial University of Newfoundland joins me now from New Zealand. Professor, thanks so much for your work on this and for joining me today.
Thanks for having me, Andrew. Really appreciate it.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.